most important part is that as soon as that tooth is taken out, that bone starts to change. And it changes pretty drastic in the first year. So we lose 75% of our bone width. And when that happens, that's gone. It's permanently gone. And then we start losing the soft tissue around that adjacent tooth, making them look longer, which causes those to become weaker. And that leads to the bite shifting and drifting. And it's sort of the domino effect. The next tooth is happening, the next tooth gets affected, the next tooth gets affected. So we end up with a dental cripple. We could have saved it right off the bat if we would have done preservation of the tooth. Nowadays we have techniques where we can pretty well take the tooth out, put the implant right away, and several times we're able to replace the crown at the same time. Well, the first is always, what does it cost? And that's a great question, but to really get to the cost of that, we need to sit down and really diagnose it. So there's like 90-some things that I look in somebody's mouth before we can diagnose what needs to be done with that single tooth implant. And if we catch the problems right up front and correct them, then it's a lot easier for the patient, it's cheaper for the patient, and it helps us develop a lifetime strategy for them to keep their teeth. Probably the next most common question I get is, how long do they last? And what I can tell you is that dental implants have the longest survival rate of anything that replace from the body. And most of the research shows them to be in the 5-year groups of having survival rates of 95-97% success rate. So 97 out of 100 of them, 5-10 years, are still doing fine. Very, very successful. And then the last question I get a lot of times is, does it hurt? And what I can tell them is absolutely no. With today's technology, we're able to go back and design these implants. Look at the bone topography, which helps save us in surgery, minimal invasive surgery. Most of my patients don't take anything past an over-the-counter Tylenol or an Advil. That's one area that they're most really impressed with, is the pain they don't have.